Khyal Cap, also known as wind attacks, is a cultural syndrome observed among Cambodians both in the United States and Cambodia. As described in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, the condition presents with symptoms similar to panic attacks, such as dizziness, heart palpitations, shortness of breath, and cold extremities. Additional symptoms related to anxiety and autonomic nervous system arousal, like tinnitus and neck pain, are also common. These episodes are believed to result from the movement of khyal, a wind-like substance, rising through the body and bloodstream, potentially causing severe physical consequences. Attacks can occur suddenly and often align with diagnostic criteria for panic attacks. Research published in Culture, Medicine and Psychiatry highlights that Cambodian refugees with post-traumatic stress disorder frequently report experiencing these attacks, which are often accompanied by intense fears of death due to bodily malfunction. Khyal Cap exemplifies a cultural syndrome, a cluster of symptoms that commonly occur within specific cultural contexts or among particular cultural groups. Kufungisisa, which translates to thinking too much, is another cultural syndrome recognized in the DSM-5 and is primarily observed among the Shona people of Zimbabwe. Across various cultures, excessive thinking is often viewed as harmful to both mental and physical health, commonly linked to symptoms such as headaches and dizziness. Kufungisisa involves persistent rumination on distressing or worrisome thoughts. Within its cultural context, it is seen as a contributing factor to anxiety, depression, and physical complaints. For example, someone might say, "My heart is painful because I think too much." It also serves as an idiom that reflects interpersonal and social stress. The concept of thinking too much is a widespread idiom of distress and explanatory model for suffering in many cultural settings, including communities in Africa, the Caribbean, Latin America, as well as among East Asian and Native American groups. Clinical lycanthropy is a rare psychiatric condition in which individuals hold the delusional belief that they can transform into an animal, most commonly a wolf or werewolf. The term is derived from the mythological concept of lycanthropy, where a person is thought to physically shape-shift into a wolf. Those experiencing clinical lycanthropy may believe they can become any specific animal, not just wolves. During episodes of this delusion or accompanying hallucinations, individuals may behave in ways that mimic the animal they believe they have become. For example, acting like wolves and wandering into forests or remote areas. According to the Journal of Neuropsychiatry and Clinical Neurosciences, clinical lycanthropy is classified as a form of delusional misidentification syndrome, in which a person misperceives their own identity or physical form. Depersonalisation, derealization. Disorder is characterized by a persistent sense of detachment from oneself, the environment, or both. Individuals with this condition may feel as if they are observing themselves from outside their body, or they may perceive the world around them as unreal, distorted, or dreamlike, experiencing sensations such as time moving unusually fast or slow. Either depersonalization, feeling disconnected from oneself, or derealization, feeling detached from surroundings, can occur independently or together. For a clinical diagnosis, these symptoms must be ongoing and not just brief or occasional. As noted by Psychology Today, temporary experiences of depersonalization or derealization can be common and are often triggered by medication side effects, recreational drug use, or other physical or psychological conditions. Diogenes Syndrome is primarily characterized by compulsive hoarding of rubbish and seemingly worthless items. It is most commonly seen in older adults and is often linked to progressive forms of dementia. Additional symptoms include severe self-neglect, apathy, social isolation, and an apparent absence of shame or concern about one's living conditions. The term Diogenes Syndrome is actually a misnomer. It is named after the ancient Greek philosopher Diogenes of Sinope, a founder of Cynic philosophy. However, Diogenes did not hoard or isolate himself in the way the syndrome implies. Instead, he deliberately rejected material wealth, status, and possessions, choosing to live in voluntary poverty. He famously slept in a large ceramic jar and actively engaged with society, finding virtue in simplicity and self-sufficiency. Stendhal syndrome is a condition in which individuals experience intense physical and emotional reactions, such as anxiety, panic attacks, dissociation, confusion, and even hallucinations when confronted with art. These responses are typically triggered by exposure to artwork perceived as especially beautiful, or by encountering a large volume of art in one concentrated setting, like a museum or gallery, according to Medscape. In some cases, similar symptoms can also be brought on by the overwhelming beauty of natural environments. The syndrome is named after the 19th century French writer Stendhal, who reported such experiences during a visit to Florence in 1817. It is also known by other names, including hyperculturemia and Florence syndrome. Thank you for watching. If you found this informative, please tap the like and subscribe so that you don't miss the next couple of episodes.